Let's keep this discussion going with Dr. Ebony Jade Hilton, co-founder and medical director, GoodStock Consulting, associate professor of anesthesiology and critical care medicine at the University of Virginia. It's good to have you here, doctor. Thank you for joining us. I heard others this morning talking about this news because there will be some, one can imagine, who will say, this is the reason why you shouldn't get the vaccine. And what would you're the doctor, you're the expert, say to those people and say, there you go, you don't get the vaccine?
Right. It's one of those things we know that there's risk benefits for everything that we do. But when we're weighing the risk benefits of vaccination versus COVID-19, what we know is that persons with COVID-19 have also presented with myocarditis or pericarditis, which is the inflammation of the muscle or inflammation of the lining of the heart. What we know is that even outside of COVID-19, normally myocarditis occurs about 10 in every 100,000 people a year. So if we're saying 10 in every 100,000 persons versus 12 cases in every million persons, we see where it's not necessarily, that's why we can't say this is a causation. We can say it's associated with, but how many of those persons would have developed myocarditis anyway? Now, that being the case, what we do know is that these persons typically have mild symptoms as far as the myocarditis, and they respond to medications like anti-inflammatories, like steroids, for instance. So I would not at this time tell people to hesitate to get vaccinated. COVID-19 is still taking at least 400 people's lives a day. And the ages of those persons are getting younger and younger as we go along in our course.
Doctor, do you think this is going to delay getting the vaccine approved for children under the age of 12?
I don't think it will delay. Honestly, it's one of those things, again, I hope this boosts confidence in the American public in that if there is something that is coming up, even though, like I said, it's less occurrence than what we see naturally in the course of the year as far as myocarditis is concerned, we are taking the steps to say, hey, public, if there is something that's on our radar, we will pause, we will reflect before we move forward. And I hope that gives people the confidence to say they can trust the system, that the system is working to uncover every rock, because every one person that has an adverse event, their lives matter, and we are taking it seriously.
I'm curious what you're seeing and what your colleagues are seeing inside medical centers, because I did hear, along with that other discussion, a medical person saying that within their hospital, nobody who's been vaccinated has developed COVID or this Delta variant. Are you seeing those kinds of drastic, you didn't get a vaccine, you're coming in ill, whereas if you had the vaccine, you're just not presenting?
Most certainly, we are seeing people who are not vaccinated with more severe cases. But I will say I do know of someone who was vaccinated the last dose of Pfizer vaccine on February 12th and was diagnosed with COVID-19 2 or 3 weeks ago. And it brings up this notion of this Delta variant that people really have to get serious about how these mutants are developed. For one, we know that mutants or mutations of the virus comes about because the virus is allowed to pass from person to person. The way we stop that passing from person to person is through vaccination, right? But we do know that the Delta variant, it is here. It's now 30% of our cases in the United States of America. We know that it has the potential to evade our immune system and make our vaccines a little less efficacious, which means we have to remain hypervigilant. You have to wear your mask. You have to avoid those large crowds until we get ahead of this virus. And I do not feel like we are there yet.
Doctor, what's your biggest worry right now? When you mentioned the Delta variant, are you worried that this could potentially cause another pretty significant wave here in the U.S.?
Yeah, I think we have the potential to have a pandemic within a pandemic. And why is that? Because we know that the vaccine uptake, yes, we've crossed over nationally 70% of all adults over 30 being vaccinated, but we know that it's not consistent across our country. We know the Northeast is doing a fantastic job, but down south, we are having vaccine hesitancy show up. And at the same time as this vaccine hesitancy, we're having an increase in our Delta variant. And what does that translate to? Well, overall, the United States, our cases are down 21%. But if you look at Oklahoma, it's up 68% in the last 2 weeks. If you look at Missouri, it's up 45% of cases in the last 2 weeks. Arkansas, 42%. We cannot let our guards down thinking that if within the nation, if we're seeing 70%, that's herd immunity. COVID-19 cares about what's happening on your street level. It cares about what's happening as far away as India, right? With the Delta variant. It all is tied into one. So you have to think in this pandemic, what's happening globally, but then also what's happening within my zip code and how can I protect myself and my family.
Doctor, I just wanted to follow up quickly with what you said about that breakthrough case, which we've been told are rare. The person had both shots of the Moderna vaccine and then tested positive for COVID-19. Their symptoms, again, did that presentation, though, rise to the severe level that we'd seen in the past, or did they have protection because of the vaccine against it becoming a much more serious illness?
Right. And I certainly, this is my friend, and she actually wants me to share her story because she says she hopes people realize is just how, not that she didn't take this seriously. She was very precautious, but she went to on a business trip and contracted COVID-19. And her symptoms were loss of taste and smell and also having chest pain. So she, months after being vaccinated, was exposed to this variant. And here we are. So the risk is still there. We know we're seeing it in the UK of where fully vaccinated persons are not only getting sick, but they are also unfortunately passing away. This Delta variant is a game changer, and it does have the potential, again, for us to see a pandemic within a pandemic. So we can't let our guards down. If you can get vaccinated, for sure, get vaccinated. You can text your zip code to GetVax, which is GETVAX. And because I do not know if she was not vaccinated with the symptoms that she presented with, if she didn't have that head start, if her immune system didn't have at least some form of antibodies ready and available to protect her, I don't know what her course would have been. So, yeah, it's time to protect yourself, like I said, and protect your family.
We appreciate that advice. Dr. Ebony Jade Hilton, co-founder and medical director of GoodStock Consulting, also an associate professor of anesthesiology and critical care medicine at the University of Virginia. All the best.